I've been honored to treat thousands of pediatric patients over the years. The common disorders in children involve fluid in the ears, ear infections, and enlargement of the tonsils and adenoids. The important thing about pediatrics is to really listen to the patients, find out what their needs and fears are so that we can best address them and keep them comfortable. The other part that's important with children is to explain the diseases and treatments to their parents so they can understand and aid the children in the process of getting better. Children are generally examined in their parents' lap to keep them calm and comfortable. Our office is child-friendly. We have an appropriate waiting area for children with a TV at their height and appropriate children's chairs. Children's magazines are also available. The most common procedure performed in children is to place tubes in the ears called myringotomy tubes. These are placed for those children when they have fluid in the ear that is present more than 4 months, particularly when it's causing hearing loss. Tubes also get put in the ears for those children who have repeat ear infections more than 5 in a year. Risk factors for repeat ear infections include daycare class size greater than 6, secondhand smoke, drinking laying down on your back, and pacifier use. The second most common disorder in children that we do surgery on is the tonsils and adenoids. And the tonsils and adenoids are lymphatic tissue in the back of the nose and back of the throat. This tissue works till about age 2, helping the immune system develop. After that, they do not function anymore, similar to that of an appendix. After age 2, when you get sick, you sometimes see little red dots in the back of the throat called isolated follicles, and this is what takes over. Tonsils and adenoids are commonly removed when they enlarge and children have trouble with breathing, snoring, and sleep apnea. They're also sometimes removed for children with repeat strep throat or repeat tonsillitis more than 5 in a year. Surgery for this is commonly performed at our surgery center in Southfield, where the parents are allowed in the room with the children while they're going to sleep. This allows the children to be more comfortable and allows less anesthesia to be used and makes the anesthetic safer. Children can then have a slushy or Slurpee in recovery room prior to going home. The other important part of tonsillectomy is it can be painful after surgery, and treating children's pain is very important. Typically, children receive a combination of Motrin, liquid narcotics, and liquid cortisone, and I find this combination gives superior pain relief. Another thing we see children for is attention deficit disorder, and at times children need to have their hearing tested because hearing loss can sometimes mimic ADD. Another thing that's important to screen for in ADD children is sleep disorders. Sleep apnea can often present as ADD as children move to try and keep themselves awake in the classroom. Also, narcolepsy is another sleep disorder that starts to plague kids as they get into adolescence. The other thing that sometimes confuses ADD and dyslexia is we often see children who have trouble reading where they will scramble the words and lose their place when they read. There's a disorder called vertical heterophoria syndrome where one eye is higher than the other, and typically children will have one eye on one line and one on the other line. They may also have symptoms of car sickness, headaches, and tummy aches, and getting their eyes in alignment can definitely help with their dyslexia and their reading. Another new area that we're starting to see in children involves hearing loss, as children are exposed to more loud noise with iPods and iPads, particularly through earbuds. Unfortunately, I've seen a 4-year-old child in the office with an unsupervised iPod who had the equivalent hearing loss of a factory worker who'd worked in a factory for 20 years. There are new earbuds available that are kid-friendly that have an 85 decibel limit on it to help protect tender ears from noise exposure and hearing loss.